heal the world. Make this a better place for you and for me and the entire human race. There are people dying. If you cared enough for the living, make a better place for you and for me. Heal the world, guys.
Welcome to this episode of Movement Medicine Podcast. What a fantastic introduction.
Hey, thank you, Darren. Hi, Rajat. You're a living legend, and I'm honored to be on this show with both of you.
Thank you so much for being. This was awesome.
This is a bit of what I do. It's a part of my life that I could never get to. I wanted to be a rock star ever since I was a little child, and I saw Pink Floyd and Bono perform and Dire Straits, but it was not to be, unfortunately. So pretty much in the beginning of our careers, we started this band, which Rajat, you will identify. It was called the Rails and Ronkai. Rails and Ronkai are the breathing sounds that that patients with lung ailments make. And we were a flop band, so quietly we moved ourselves and we called it the Flunkies. And the Flunkies made it big, and we performed almost every Saturday night at the erstwhile Jazz by the Bay on Marine Drive in Bombay. And eventually we have a band now.
Fantastic. Well, welcome to this episode, everyone. Thank you to everyone that's tuned into the previous episodes. We thank our partners for the podcast. So that's the Fit India Movement, the Back to Fitness Clinic, which is the clinic that Rajat runs, La Ultra The High, which is the ultra marathon that Rajat puts together in Ladakh, and the Moving Mountains Within Film, which is the film about the 10th edition of La Ultra The High. So I'll pass over to Rajat, who will formally introduce today's guest.
Abhay, it's a pleasure having you. It's an absolute pleasure, buddy. So could you just do a little introduction about your professional career, pre-professional career as well? You know, about the music. You said a bit, but it'll be amazing to hear more about it.
Yeah.
And whatever's been
actually, I'm a doctor by accident, so it might enthuse you to know that I'd actually taken up engineering at Thadumal Sahani College in Bombay, chemical engineering. And at our times, the only options were, after you do well in your grades, you take up medicine or engineering. And because the engineering list was out first, I just took it up. And it was only after I realized that I was making it to medicine, again, by the skin of my teeth. My academic career has been a skin of the teeth career. I've just made it into Jai Hind College, just made it into med school, just made it into orthopedics, always the last seat. And so I did my undergraduate and postgraduate training in Bombay itself. So I'm born, raised, and studied in South Bombay. I didn't, leave the confines beyond Haji Ali until much later. After finishing orthopedics, which was, I think, a mother of all trainings, training for orthopedic surgery in Bombay City is an absolutely high demand, highly adrenalized kind of residency. You're practically working 72 hours sometimes. You have an option between breakfast and shaving and things like that. You're working around the clock. You're sometimes giving a hand to your general surgery. Basically, it grows you up. So after that, life took a turn for a more specific and, more charted path, because I met a mentor who became a life coach. I would like to name him Dr. Shekhar Bhojraj, who's the god of spine in our country. And he kind of held my hand and took me on the path, so to say. Otherwise, I was all over the place. And since then, things have, gone possibly in the right direction, because I partnered with my mentor, and now we're a pretty bustling spine team, one of the busiest in the country, well known for our academic outreaches, and we are called WeAreSpine, and we have a spine foundation under our belt, which right now caters to 22 off-urban, non-urban, rural spine surgery setups free of cost all across the country. And the Spine Foundation is again a brainchild of Dr. Bhojraj, but we all work for it, relentlessly. So that's been the academic career. Presently, I'm a private practicing spine surgeon in the city of Bombay. I work off all the major corporate hospitals in Bombay. And my subspecialty is spinal deformity, pediatric spine, and spine tumors. But for bread and butter, you got to do slip discs and spondylosis also.
Fantastic. It's incredible to hear about all of that. So you're obviously wearing an Indian cricket t-shirt there. Can you tell us about your interest in sport and also your own sort of fitness and exercise interests as well?
Yeah. So actually, it was when I was younger, I would look at people who who spend time on fitness as losers. I would say, these guys should be out there playing cricket, playing tennis, playing badminton, because I played all sports at a fairly good level. Cricket, tennis, badminton, football, chess, bridge, everything. I mean, if you call them sports. And I didn't do anything for fitness because there was so much time spent on this, and but the enthusiasm was there. Cricket, of course, being an Indian, it's that XXXC gene. The C is for cricket, so it's like genetically, so endowed in you that you just breed cricket. And I was fortunate, to run into a lot of cricketers during my career as a sports doctor, if you may. So basically, I'm a cricket fan. However, after a certain age, you realize that these sports, especially things like cricket, where you need 22 players and you need a big field, are not so forthcoming, and it's not easy to practice fitness through sport. And that's when I kind of moved gears, and I started with road running way back about 25 years ago. And I was only crazy doing night runs in South Bombay, and probably there was no Savio slaves, there was no striders back then, and people would look at me like this, who's this crazy guy in shorts running at 10 in the night, because that was the only time I would get to run. But I would do the slopes on Malaba Hill, and it would give me my adrenaline, because there was no cricket and there was no tennis even, because it was hard to get partners who were as bad as me. And so running became a passion, and I've run I'm of course a half marathoner, not a patch on what you guys do, Rajat, nothing close to what you do. But I have run in Leh also, but not the official Leh marathon. And so slowly I took it up to a notch, and I ran the first and then subsequently every Mumbai half marathon. So I've been running the half marathon for 16 years, I think now 17, I'm not sure. And I took this on later because there's a lot of travel involved in my academic career. So I travel, of course, not for the lockdown, but otherwise I travel, like I have 3 outstation visits every month, maybe, and maybe 3 months or 3.5 months of the year I'm out of Bombay. So I started packing up marathons related to my meetings. So I've run in Dallas, I've run in Salzburg, I've run in another place in Austria, I've run in Munich, all linked to my conferences. So it becomes so easy and so much fun. After that, after 45 and after meeting Anand Joshi, I realized that running is good. So far my knees are holding up, but maybe in another few years my knees may not hold up, because I only love to run on tar roads. I hate running anywhere else. So I took to cycling, and again I started cycling about 10 years ago now. And again, we were one of the first guys doing road cycling in Bombay. Luckily, being in South Bombay, the road sense is reasonable, allowing us to do what we want. Once again, I notched this up a bit further, and my first big ride was the London to Brighton, the ride for the British Heart Foundation through my Parsi friends in London. So 11 of us, called the Flying Zorros, completed that ride, and out of nowhere, I was like number 1 in the group. So I realized that there is some potential there. And then subsequently, I took up big rides. We did some famous rides, the Delhi to Bombay non-stop ride, for the Worli 545 charity ride. I cycled from Manali to Leh. That was probably the most back-breaking experience of my life. I never am going to do that again. I'm putting it on record. I did the tour of the Nilgiris, again with Anand Joshi and Aditya Daftari and the other doctors. And we were just 30 of us who finished that grueling 9-day 1,000-kilometer ride out of the 81 who had signed up or who were selected. Tough ride, but fun. I did the WOV cycling, pan-Iceland cycling. So we cycled along the diameter or perimeter of Iceland, again with a similar bunch of crazies. And then now every summer we go to Europe and do like Vienna to Budapest or Venice to Croatia, or some long 8 or 10 day ride. I've actually motivated a bunch of spine surgeons to do it, and we call ourselves the Ninja Turtles, mainly because we cycle like turtles. So that's it. So then running and cycling, and if you still want me to go on, we've pushed this into mountaineering, and have a huge passion for the peaks. So using this fitness, I've been doing some tall peaks of the last 5 or 6 years. Before that, I used to do shorter treks. I think 5 or 6 years ago, I did the Everest Base Camp, and that kind of switched gears. And I was able to even summit the Stoke Kangni, which is a 6,100-meter summit. So that's been the high point, I would say, of my mountaineering career. So that's that for fitness.
Abhay, so since you talked about the spine and the spine surgeries that you do, what are your thoughts on things like a disc bulge and pain, and the surgeries that are rushed? What do you think about that?
I think again, the truth be told, that 90% of spinal disorders need only lifestyle change. They don't need surgeries. They don't need interventions. They just need a good person to counsel you on what's gone wrong. Because it's not even a disease or a pathology. It's like an injury, and partly it's an aging process. So once the penny drops as to why this has happened or why you hurting in the back, mostly you're able to turn your life around it. And we've got famous examples who've done that without intervention. That leaves us spine surgeons in a tight spot, because we get to actually do surgery for less than 1 out of 10 patients that we see. So if I see 50 patients in an outpatient, I would end up advising surgery to 5 of them, not more. And the 5 who actually need surgery, again, the truth be told, can do fantastically well. I've had people with scoliosis surgery running marathons after the surgery. I've had people with disc surgeries running the Leh marathon and doing big mountains. So I think if you have a right counselor, then spine problems are really not as big as they are portrayed. Like a disc bulge is almost like saying I have gray hair. So what? Deal with it and move on. So there's a lot of misconception, a lot of myth that is spread. I'm going to say partly by our guys also, because we make a meal out of it. And if there was a better way of reaching out to more people and educating them about the structurality and the simple physics of the biomechanics of the back, I think more people would be happier with less.
Do all of your colleagues have the same sort of view as to sort of rehabilitation? People who would dream to be able to do these marathons, you can obviously give some clear examples of where your patients have been able to do that. Do a lot of your colleagues have the same view?
Unfortunately not. And I think that's where my sporting or exercise background comes into play. That because I'm so hung up about my run or my cycle or my gym, that I can't kind of function without it. I fully identify the guy who comes to me and says, my back hurts if I run beyond 15 kilometers and I want you to fix it so I can run 30 or 40 or whatever. And unfortunately, most of my colleagues would say, you're crazy doing that kind of running. Just switch to swimming or stop doing exercise and just do what I'm telling you to, etc. And I think that's not the way things are done. I would rather that I modify your back to suit your life rather than you modify your life to suit your back. It's as simple as that. So with that background, I'm I sympathize and I feel for these guys, and I put a lot of thrust on rehab. So once again, the same surgeon or a similar surgery could be done by a surgeon with equal capabilities, for different people. But the guy who invests in post-op or pre-op rehabilitation, I think this is the guy who's going to run the marathon or climb the mountain.
And what about MRIs? Because that's again one big issue, right?
Yeah. So I'm going to say this, that MRI scans were designed to fill the coffers of spine surgeons. Because even a dead man's MRI shows slip disc, So, I mean, what are you getting at? So let me get more scientific and more tight for the medical listeners, that what the MRI shows is the structure of the spine. Remember, your spine is like the mast of a ship. The mast standalone maybe takes 50% of the load, that too when the ship is parked. But when you take the ship out to the winds, it's the ropes around, the dynamic supports, which is your muscle, that really takes the load. So even a bad back can be very well compensated by good muscle and lean, ideal optimum body weight. So if you can change the person around the bad back, which the MRI shows, the MRI is merely a name tag. It really doesn't matter, and which is why I said that people with lousy MRI reports are doing things that you and me can't do.
That was actually going to be related to my next question. Obviously, I'm very interested in skeletal muscle. That's my research background. I was going to ask, what role does muscle have to play in a lot of the spinal disorders that you see? Can a lot of them be attributed to just poor weakness of a lot of the muscles that support the spine?
Yeah. So I'm going to challenge that a bit. You need a bad back. You need a degenerate disc, or physiologically a bad back, for the muscles then to be the targets. What I mean is that if you have a fully healthy back and weak muscles, you'll still make it. But you have an unhealthy back, which means you have degenerate discs. So let me quickly take you through a small tutorial. In your back, there are bones, which are really not the problem until you're beyond, say, 65. There are discs, which are cushions in between these bones, and these discs are like shape memory pillows, and they give your back a strong shape memory and yet give it flexibility. Now, by natural wear and tear, by natural history, all our discs, more so in the mobile units, the neck and the lower back, they degenerate. Degenerate means dehydrate, just like the sponge of your sofa dehydrates after using. So it loses its shape memory, and hence the back becomes weak. Now, such a back, if not compensated by three things: good musculature, which muscle? Abdomen, sides, and back. Second, body weight. So keeping your body weight optimum. You can't say that now I'm 50, so I'm allowed to be 20 kilos heavier than I was when I was 20. Not allowed. If you want to live the life that you led when you were young, you got to stay that way physically, and it doesn't take much. It's just discipline. So good muscle, good body mass index, and good habits. So according to me, why is spine surgery bursting on the seams? Why are we all doing so well and we live in such great homes? It's because of the modern lifestyle, and the modern lifestyle revolves around sitting and around digital instruments where your neck tilts down. So a simple thing like a mobile phone, when used like this, the neck is going to be loaded 3 times or 4 times than the normal 10-pound weight of your head. So you've got to learn that habit of holding the phone up and working, or books or computers or anything. But unfortunately, people don't do that. Even the simple act of sitting. Man is not designed to sit. The back has a shape. The low back has a shape which is curved out in the front. That's what keeps the center of gravity behind. So the minute you sit, your pelvis tilts forward and your back goes into a shape similar to what it would be when you're bent forward. So except that it's in another axis. So as soon as this happens, the center of gravity moves forward, your discs get a beating, and your back's bound to hurt. So 3 things: body mass, body weight, good trunk muscle control, and good habits. That's going to keep your back in good shape. For a normal person, not a Roger Federer or a Virat Kohli, to have muscle-related back pain is unusual, because the simple standard muscles can handle a normal back.
So just to play devil's advocate here, if you've got an individual who, particularly during this lockdown period, is going to be sitting on their sofa a lot, they're going to be watching a lot of television or looking at their phone or playing on their laptop or whatever they're doing, could that in itself not develop muscle weaknesses and muscle imbalances that contribute to sort of spinal degeneration?
Yes, I fully agree. Reconditioning that you mentioned, Darren, that when you're inactive, you're deconditioning your muscles, and the normal suddenly changes, and what your muscle was used, what muscle support your back was used to suddenly is pulled off. But I can still kind of counter this by saying that the same level of inactivity in a 12-year-old versus the same level of inactivity sitting, etc., bad habits of the lockdown in a 40-year-old are going to have a different, are going to result in different problems. So 12-year-old whose back is really springy and healthy could sit all day, could tumble, jump, somersault, or and not still hurt. And someone like me, if I just sit for a few hours on my sofa, I might come up with a creaky back.
Okay, so with your background that you have versus other colleagues that are there, how is your practice or advice different for a bad back when they come in? I mean, we've covered it, but yet, how is it different from the other guy? They're rushing for the surgery versus what would you have to say to them?
Yeah. So actually, number one, I think, like I said, counseling is very, very important. You got to know what the customers come to you for. He may have come to you just so that he can. So one guy may come and say, you know what, I can't walk 100 meters and I need this fixed. And someone may come and say, you know what, I'm walking 100 meters and I think I'm happy. So it's the person and what he needs, because we are in the business of quality of life, and we are not in the business of saving lives. So my wife is a chest physician. She's right now on the front line saving lives, fighting the COVID from the ICU in Bombay Hospital. But I'm just a quality of life doctor. So if you're happy with your quality of life, I'm no one to decide that 100 meters is not good enough and you need to walk, many more miles. So I think that is number one, to judge the person who's come to you with his demands, similar to the runner that we spoke of, who says that I want to run 15 and 20 miles and you make me fit for that. The second is the deep down conscience telling you that back pain surgery is a failure. It's a worldwide well-known secret in our circles that surgery done to cure back pain is a failure. Surgery done to cure nerve-related leg pain is a super success. So what works better for back pain? It's rehabilitation. Everyone knows that. It's an 80-20. Only 20% of people would really need a surgery for back pain. So basically, with my background, what is different, to answer your question, is that I thrust a lot on the demands of the patient, on counseling, and on rehabilitation, whether it's before surgery, after surgery, or instead of surgery.
So there's a lot of evidence to suggest that back-related disorders can be affected by the joints that are actually peripheral to the spine itself. How would you sort of discuss that for us? So, for example, if an individual has an issue with their hip, that might actually cause problems with their lower back. Could you just explore that a little bit for us, please?
I would agree with you, Darren, there, because, ultimately your back is one part of the body that gets loaded even when you're seated. So it's probably the only part of the body which rests only when you're asleep, which may be 6 or 7 hours in the day. So everything that you do through those remaining 18 hours is going to affect your back. Specifically, lower limbs are going to affect the back, because the back is the place where the weight-bearing axis finally unites. So, for example, if you have a bad hip, like you mentioned, Darren, and you're limping on that hip, the biomechanics of the back will take a beating, and the back will degenerate faster. It's almost like saying that if you have a shoe that's worn out slightly, the more you walk, the more it's going to wear out. So it's a self-perpetuating process. However, at the end of the day, the back will not supersede the hip. So the primary pathology is in the hip. You'll have to address the hip, and you can't say, I'll fix the back and the hip will get addressed. So peripheral joints will need to be treated, and sometimes you can get away by not treating the back, but not vice versa. If it's a joint problem, you'll have to treat the joint problem.
Right. And Abhay, what about colleagues? Most of our colleagues are not necessarily very active. Most of them are very aerodynamic. How do we change that? It's a big issue, because what are you preaching? What's the point of preaching if you can't practice it yourself?
Yeah, exactly. I mean, think about it, that you go to a fitness trainer who weighs like 150 kilos. Are you going to look at him, as you're going to go away, right? You're not going to hang around there. If you go to a cop who's got a big pot belly, he's not going to make a good impression on you. So similarly, I think surgeons as a whole are looked upon as medical sportsmen. We work not with what's inside the skull, but what's outside. We work with our hands, our eyes, our ears. It's a touch-feel science. And for that, you have to be physically fit. Imagine a surgeon who has tremors. I mean, that's a no-brainer, right? Even then, imagine a surgeon who is a schizophrenic. I mean, a guy who doesn't have a good control over his mind can wake up on the morning of your surgery and, randomly screw it up. So I think mental and physical fitness are the core of a good surgeon. And, the more we say, the more it needs to be percolated across society. Luckily for us, the modern patient or the modern society also is happy to see a surgeon who looks young, fit and healthy. And he's not looking for a grey-haired, dodgy, pot-bellied, bespectacled, droopy-looking guy who's grumpy and looking down on the top of the rim of his lens. So if you are fit, I think you can not only inspire fitness in your patients, but you can command that kind of respect, and they will have to listen to you, because when they say, sir, I don't get time to exercise, I'm a busy executive. I say, are you busy or am I busy? And if I can run at 5 in the morning, if I have surgery at 8, or I can run at 10 at night, I think you can do it yourself. So I think if you walk the talk, it makes all the difference to the way your patients and the society perceives you in general. And, we were not brought up on this diet. We were always asked to look old, look grumpy, etc. But I think personally through my career, I've realized that I think what I do helps more than what others do.
So what would be your basic recommendation for everyone to keep good spinal health? What kind of activities would you recommend for the general population?
So I think, again, this revolves around 3 or 4 things. I think, like I said, the number one and number two, a close first and second, would be keeping your body weight optimum. And nobody, neither age nor sedentary lifestyles nor pregnancy, nothing can be a good excuse for gaining weight. No thyroid, no diabetes, nothing can be a good excuse. Everything can be overrun if you've got it up there to what to do it. So maintaining a good body weight, doing a strengthening exercise, and when I mean strengthening, I mean a sort of a resistance exercise for the upper torso and the lower torso and the trunk. So a generic strengthening exercise, for example, would be a combination of swimming and Pilates, if you may. Swimming for the posterior muscles, Pilates for the front muscles. An endurance exercise, which is something that will help your red fibers, because once again, the back muscles are endurance muscles. They need to be up and running or in a good tone for 18 hours in a day. And a very different set of muscle fibers come into play there. It's different when you're lifting a bucket versus when you're holding a bag and walking, for an hour. So endurance training, this of course could, oscillate between low impact endurance, which is the safe stuff like walking, swimming, cycling, cross trainer, etc., versus high impact if your joints and your back is in good shape, running, jumping, skipping, aerobics, Zumba, etc. And so body weight, strength training, endurance training, and good habits. How you sit, how you stand, how you ergonomically posture yourself in those 8 or 10 work hours of your day. I think if you follow this mantra, of course, the last thing is diet. Sorry, I did not mention it. Indians, vegetarians, big culprits for low protein diet. And you need 1 gram per kilogram body weight of protein. If you just rummage across, you will find even 1 egg has only 6 grams of protein. I need 74 grams of protein a day. Where is it going to come from? So figure out a good way of getting good proteins in your diet. And vitamin D, big culprit, because even if you go out there in the sun, in a city like Bombay, the smog prevents ultraviolet percolation of ultraviolet rays. So even if you sit out there, bare-chested at Azad Maidan in Bombay for 2 hours, you're not going to get your vitamin D, the UV light enough to process vitamin D under your skin. So you got to have vitamin D supplements, which will potentiate your calcium in the body to give you strong bones and strong muscles. I think, that's the mantra for me. But if everyone practices that, I'm not going to have any patients. So hide this information from the public.
Now, considering how we behave with, a couple of things Modi had asked recently, lighting the diyas and then, clapping and all that, and the way we behaved, forget about the politics of it. But we are interesting characters, right? We have enough citizens who will tell them whatever, they'll do something very fascinating after that. So don't worry. What about any misconceptions we could have missed probably? Anything else maybe that's missing, maybe we could have covered better? Like playing sports and back maybe? Like, how should you take care of the back during sports?
Instead of sports, may I touch upon what is, common misconceptions? I think one misconception is that if you have back pain, you need to take bed rest. That's a very, very, very common misconception, because bed rest is going to take you farther away from the solution, because, you need to counter-attack. Your back is bad. Your muscles should get strong. By resting, your muscles get weaker. You decondition. So there may be a sense of a few days of resting it out common sensibly when it's hurting a lot. But bed rest is not the treatment of back pain across the board. The other misconception is that physiotherapy is not the treatment of back pain, because when you hurt, you should not be exercising. When you hurt, you got to take it gingerly, get out of pain, and then do physio all your life. So when it hurts, if you start doing exercise, you're probably again hitting the wrong end of the stick. So when it hurts, take it easy, let the pain settle like any injury. And once it's settled, invest in the future by strengthening your muscles and, getting the physiotherapy aspect of it right. As far as sportsmen are concerned, there's a lot of misconception amongst the people we see that, oh, my back is hurt, my career is over. That's totally incorrect. And, there are probably more people with bad backs doing sports than, people with bad backs who are homemakers or, sedentary. So it's completely in your hands to get back to full top rehab. The topmost, sportsmen in any field that you can pick on, though we are not good to name these people, have had major back problems and have come back with full flying colors and, hitting the high notes. So I think there's no barrier. It's mind over matter.
Right, Abhay. And since you mentioned physiotherapy, for the longest time, physiotherapy refers to electrotherapy. Some ultrasound, some interferential, and whatever else. What are your thoughts on that and back pain, or any injury really for that?
So, without intending to tread onto someone else's, source of income, I'm going to again announce that physiotherapy means physical therapy, means physically strengthening muscle groups that are going to bail you out of an injured joint or an injured ligament or an injured, muscle, if you may. Everything else is hocus pocus, not evidence-based, random. Maybe a bailout, like you put ice and you put hot packs, similar you can do, shortwave diathermy or interferential therapy. Traction, needling, everything is unscientific. It may help a given guy in a given situation, but he was going to get better anyway. This may help divert pain. It's almost like taking a painkiller without a side effect. It'll divert pain for a while. It is masking the pain by if you poke needles. So the principle of all these treatments is quick short-term relief, but it is not long-term investment. So I'm not against someone going and taking shortwave diathermy from his physio, but not at the expense of doing exercises. You've got to exercise your muscles because that's your long-term investment.
Okay. Well, that's been an absolute fantastic episode, Abhay. Thank you very much for joining us.
Thank you. It's been lovely. And you guys keep doing this, wonderful job to help society in general. And I'm really lucky and really proud to that you've selected me on this episode. Jai Hind.
Thank you very much.
Thank you so much.
Okay, so we'll bring this episode to a close. Thank you for everyone that's tuned in, and we'll bring you the next episode very soon.